Right, okay, so hi everybody, I'm Charlotte from Berry Healthwatch. Today we're doing our Facebook Live with the Caribbean and African Health Network. So I just want to give a brief introduction and go through some of the rules today. So some of our live stream guidelines: number one is to be accepting, everybody is welcome, regardless of race, ethnicity, national origin, religious affiliation, sexual orientation, sex, gender identity or ability. We need to respect each other's boundaries. Don't make advances or comments on appearance that might make someone feel uncomfortable. Don't be rude, don't intentionally provoke, threaten or insult anyone. Don't flood the chat. We do want to keep the conversation going, but we don't want to have the same comment repeated over and over again. It stops other people from coming through. Don't self-promote. We're not here for sales pitches. We need to stay focused on the topic of the stream today. And if we can keep it clean, please. No shocking, obscene, vulgar or inflammatory language. We need to leave that out. Today, I'm obviously doing your introduction now. I will shortly be followed by Sandy, who is part of the Caribbean and African Health Network, and she'll be able to explain more about the work that they're doing at the moment and the contribution to society and obviously all that great stuff. And then Steph will take over and have some questions to ask for her. So Healthwatch in general, just to explain a little bit about who we are. We're the health and social care champion, so we make sure NHS leaders and other decision makers hear your voice and use your feedback to improve care. We listen to your experiences of using health and social care services and share them with other people to make change happen. And we also provide you with information and advice. We can support people by signposting them to local or online support groups. We can give information and advice about you or your family members' healthcare. We can listen to your experiences of using healthcare services in the Bury area. And these are our lovely contact details. So I am going to stop sharing my screen and we can listen to all the great stuff that Sandy has to tell us.
Perfect. Thank you very much, Charlotte, and thank you for Healthwatch Berry for having us. So my name is Sandy Kuju. I'm the head of community engagement and empowerment at CAHN. We also have an advocacy and DVSA, domestic and sexual violence service that I lead. So it's a pleasure for me to be here today and to talk about our services and what we do for the community. We serve Greater Manchester overall. We're also working on a national level, but I'm going to share with you what we've done with Bury and with the community in Manchester overall, Greater Manchester. So I'm going to share my screen, if that's okay, and go through a quick presentation. Okay. Okay, can we all see my screen? I believe so. Yes. Okay, so I'm going to start with the vision and mission of CAHN. Our vision is to, in a nutshell, our vision and mission is to end health inequalities for the Caribbean and African people within a generation. So hopefully everything we're doing now is contributing towards that vision. Our objectives is to work collaboratively with Caribbean and African faith and community organizations to strengthen their structures and systems so that they can be responsive to meet the health and well-being needs of the community. We also build partnerships across sectors and to be the point of contact between communities, voluntary sectors, sector members and commissioning agencies. The main thing I want to say here is that we would love to see ourselves as the middleman between statutory organizations or any other VCSE sector organization with the community, with the Caribbean and African community. So in working within this sector or as part of this partnership, we can not only contribute to the well-being of the Caribbean and African communities, but also empower people to take part in decision making, really. So why CAHN? The reasons we have, there are various reasons why us, why it's a good idea to work with us, or why we want to work with community members and other partners. one of the first issue we've noticed or we came across after various webinars or engagement with the community is poor access. Overall, community members, and when I say community members, I'm referring to the African and Caribbean community, access to services is very poor for various reasons. Can be lack of information, it can be, I mean, there are various reasons, hopefully we can touch on that later. Lack of trust during the pandemic, unfortunately, the COVID period shed some light on some issues that were already existing, I will say. But one of the main problem is the lack of trust from community members to the system. So we're hoping to rebuild that trust. Poor engagement, again, many people from grassroots communities are not very much engaged when it comes to projects, community projects or well-being projects or project overall. Again, this has come out from some surveys we carried out during the pandemic since, I mean, I would say for the past 2 years, really, where we noticed that communities were not aware of what was going on within their localities. With the style of engagement, I mean, I myself, as I mentioned earlier, I'm the head of community engagement. We've used several approaches to get the community involved in some government-led projects, predominantly the NHS. Inadequate knowledge of research. Again, we noticed that many members of the community are not really part of research programs. And we're hoping we're collaborating and we're working in partnership with various organizations to make sure that members of the communities are represented when it comes to research. Bias of structural system, processes and practices. Again, this is where we talk about institutionalized racism, where unfortunately some habits in the system needs changing, because sometimes people don't even realize that what they do is wrong, or the practices or something they've been doing for many years, it's not appropriate and does not serve various communities. So these are our health priorities. In terms of health streams, we work or we look into cardiovascular challenges, cancer, mental and emotional health, respiratory conditions, bloodborne and immunological conditions, and reproductive and sexual health. We have various webinars on health. Our webinars touch either of these, one of these issues. One of the popular webinar we have is the Health Hour every Saturday morning from 11 to 12, where we have a doctor, usually a Black doctor, to talk about a specific issue. We've had somebody talking about cancer, we've had somebody talking about, we had a mental health doctor, we had an immunologist, we have various specialists really, and this is something I will really encourage community members to attend, participate. It's not only for community members. I believe anyone can benefit from these sessions, really, because we know that having access to a health professional, especially a specialist, is not as easy as we think. Other areas of work, so eradicating health inequalities and disparities is our focus overall. So it's not just health disparities, I will say social disparities as well, because I did mention that we have an advocacy and domestic and sexual violence service. So in a nutshell, we do educate and train community members, VCSA sectors. We have a program at the moment called Be Hip. So that is the Black Health Improvement Program, where we provide some sort of cultural competency training to doctors At the moment in Manchester, I think we've trained over 1,000 health professionals or doctors. We're running the same program at the moment in London, and it's very helpful. It's just helping doctors and health professionals to understand on a cultural level the patients they're serving, really, or the community they're serving. Health and well-being services and projects, community engagement and empowerment. We have various projects on there as well. Research and innovation. We're part of various research programs where we get the voice of the community on the platform on some of these projects as well. Organizational development and capacity building. We help community organizations to grow, really, because we know that with many grassroots organizations, they're still in a stage that they're still in a growing stage, and they need loads of support. So we do a lot of that as well. Some structural barriers. Again, I'm not going to go into too much details, but if any of you have any question at the end of the presentation, feel free. But some of the structural barriers that we've come across, again, as part of the surveys we carried out in the past, excuse me, decision-making and representation. Unfortunately, many people from the community do not have access to decision-making processes, or are not involved in decision-making, and representation is very low as well in various fields, benchmarking to majority populations, racial discrimination, unconscious and conscious bias, as well as poor community engagement and investment, especially in the faith sector. So our work on a daily, weekly, monthly basis is hopefully to challenge some of these structural barriers and hopefully reduce them. This is a quiz. I'm not too sure we have time to go through that now, but in terms of factors influencing access to healthcare, we have education, language, religion, culture, migration, immigration policies, socioeconomics, social networks, bias and racism, previous experiences, and communication. The reason we mention this is because, again, as part of the survey and as part of our engagement approach with the community, we know that these key factors are very determining in present themselves as, are the key factors influencing access to healthcare. It's either there's a barrier when it comes to languages, religion, perception of culture, policies, people not understanding policies, and various various other reasons. Effective community engagement. Again, community engagement is key for us because it's important to make sure that we voice community concerns. And in doing so, we do collaborate with the community, we do consult them, we have an equitable approach to relationship building, internal and external. Communication is key as well. We do use our community language. We use community members to communicate the key messages from the government in their various languages, whether it's ethnic languages or just speaking at their level, really, and understanding, helping them to understand things in a certain way. We have them to participate in projects as well, and there's a racial lens aspect. So yeah, a very diversified approach. So this is how you can join us, or how you can follow us on Twitter. The Twitter account, this is my boss's account, but our CAHN Twitter account is CAHN_GM, and the email address will be info@cahn.org.uk, or if you would like to call us, we have a helpline, 07710 022 382 So thank you very much, Healthwatch team. I'm going to stop sharing now, and we can get some questions.
Thanks very much for that, Sandy. It seems like you're doing some really important work and really highlighting some proper core issues at the moment that that people are facing. I'm going to pass over to Steph so she can ask you a few questions, and we'll talk soon.
Thank you.
Hi, Sandy.
Hi, Steph.
Thanks for that very enlightening presentation. Obviously, I learned a lot as well, and I hope that many of our viewers learned a lot as well. I just have a few questions to follow on from that. So, obviously, 1 minute, can I just have a quick scope at the questions? Sorry about this.
It's okay.
So, so if someone is a member of the African or Caribbean community and they want to stay healthy, is that something that CAHN can help them with, or can you signpost them to other organisations who can maybe help them?
Yeah, sure. So, yeah. So if somebody can definitely help people to stay healthy. One webinar I did not mention is the Healthy Heart program. So Healthy Heart is a new, well, it's a session we have every Tuesday from 6 to 7. I can share again the flyers, or some of this information could be on our platform, Twitter and Facebook. But Healthy Heart is a 1-hour session where we have a physical instructor for 30 minutes. So for those of you who are comfortable in their space, you know, you have the comfort of a physical instructor on screen helping you to do some cardio exercises, and you don't need to go to the gym. You don't need to, you know, you're just staying in the comfort of your home, really, and doing some physical activities. So as part of this session as well, we have a nutritionist talking about healthy stuff, you know, the calories intake, calories in your food. And we know that with especially African and Caribbean food, many food are not labeled in terms of calories. I'll take an example of plantain. I don't know if any of you will know plantains or beans or yams. Usually people do not know how much calorie we have on there. So the advantage of these sessions is that, again, we use Black health professionals because they have this additional cultural knowledge of what the ingredients, or not the ingredients, what the content in terms of calorie with the ethnic food or cultural food we have. So they are able to give more details, really. So that's one thing. The other way of staying healthy via CAHN is to log on to this Health Hour session I mentioned every Saturday morning. It's very, very, very interesting. I'm not just saying that because I'm part of CAHN. Even if I wasn't part of CAHN, just having a session where you have a doctor talking about, last session, a doctor talked about lupus and fibromyalgia. I always struggle with that spelling. But yeah, those are the sort of things, those are the sort of conditions you will love to have a first-hand information from a specialist, really. Or whether it's diabetes. We had somebody speaking about diabetes type 2. We know that in our community, diabetes, unfortunately, it's a prevailing health condition. So having a doctor to answer questions from community members, it can only be beneficial, really. And in addition to that, we also have other webinars tackling other health issues. We recently had a session that was a face-to-face session where the topic was suicide prevention. Again, we know that it's a difficult topic within the community. People don't really talk about suicide, but unfortunately it does happen. A few months ago, a young girl in our community, 14 years old, took her life. Parents don't talk about it, people don't talk about it. So we use those sessions to educate the community and just make sure that those topics are on the table. So in terms of sharing information to help people to stay healthy, we can definitely do that. We also have an engagement approach where we have various WhatsApp platforms for community members in the various localities in Manchester. So we have an engagement in Bury, for example, and again, like the 10 other in the 10 other localities in Manchester, we have various groups we're engaged with, and via those platforms we share relevant information, whether it's information, so like Anne-Marie at some point was sharing some useful information. We'll take that information because, you know, you are a key provider in the community, and information from you, it's not, you know, it's factual information. It's not just any information from YouTube. So we use those sort of networks to share information within the community, just so that people have access to the relevant information. We also get information from Public Health, PHE, Public Health England, and we share the information to our community groups, whether it's via emails, WhatsApp, any means we have really to share information. So I don't know if I've answered your questions there.
Yeah, I mean, that's very interesting, and obviously there's a lot of groups out there, and it's good to know that, you know, you as an organisation, you get your information from reliable sources, so that's really good to know. I've just got 2 more questions. So if a member of the African or Caribbean community has been recently discharged from hospital, they have very little support outside of that hospital. So is there any support you could give them as an organisation?
Yeah, thank you for your question, Steph. That's a really good question, and I'm happy you mentioned that, because again, we have a service we're providing at the moment, and I did mention that as part of my presentation. It's a call 25+, so it's a hospital discharge service. Which means that if somebody from the African Caribbean community has been discharged from the hospital and needs further support, there is a helpline. The helpline I shared with you, and I can share the helpline again throughout this conversation. People can call that number, and somebody will get back in touch with them for further support. And just to share more information about the support we provide as part of this service, it's anything really from supporting people with their benefits, supporting people, speaking on their behalf with other organizations, because you can imagine someone who's just come out of hospital, it's not in a great state of mind to you know, to carry out other activities and tasks. I mean, they're possibly worried about their health. They're not strong enough, and mentally, they're not strong enough either. So they need that extra support. So that's what we do. We can call, whether it's the hospital or the housing or the benefits office, to follow up on a few, you know, to follow up on what needs following up with, whether it's helping them to purchase some food as well, because if somebody is, let's say, an elderly person and they live on their own, and they've had an operation, you can imagine how stressful they could be, thinking that they may have to go out and buy food. So that's the support we can provide as well. We can help them with shopping. We can help them, you know, taking them to their appointment as well. We can organize transport. We can organize anything really, as long as they need the support. We'll find a way to bring that support and make sure that the discharge is as smooth as possible.
Thank you, Sandy. My last question would be, obviously we know isolation's a big part of society. You know, people from all different walks of life can feel very isolated at different points in their life. So as CAHN, is there any like thing that you offer services to help reduce isolation, whether that be social groups or anything?
Yeah, thank you, Steph. Again, that's another very good question. In terms of isolation, we started that during the pandemic, really, where we have groups or networks within each locality. In Bury, we've started a network, although, I mean, the Caribbean and African community in Bury is not as big, but for those who have been in contact with us, it has been very, it has been really useful for them to take part either in our webinars or as part of the engagement we have in Bury, to take part in some of the monthly meetings we have, whether it's just sharing information, whether it's just, you know, listening to them and having them share their challenges. The feedback we received was really, you know, was really interesting, because again, many of them in Bury do not know or did not know during the pandemic where to go. And the fact that many of our sessions were online helped them to sort of reconnect with the community, because some of them were in isolation, some of them couldn't, some of them were elderly, couldn't leave their homes. So we have that network as part of a, you know, we can call it a support group, yeah, it's a support group in a way. But in terms of supporting, we have this befriending service as well, where people know that they can call us and we'll check on them, we'll give them, and this is part of our advocacy service. So in Bury, for example, we've supported some community members from the Caribbean and African community. We've supported an elderly person, for example, who did not know in the midst of the pandemic where to go, how to get help just to purchase food during the Christmas period. This person was very lonely, so we arranged for food to be delivered, and this gentleman wanted some Caribbean food, and we arranged for Caribbean food to be delivered. We also gave him a Christmas basket, Christmas present, and he did not expect it. And you know, he was really, he did not ever know there was an organization that could do that. So just the fact that we kept in touch with him, we called him every now and then. Again, it's somebody who doesn't have family around. He's an elderly person in his 80s, doesn't know many people. So up until now, as I speak, we're still in contact with him. You know, just the fact that he can, you know, somebody can call him and he can speak with someone when he wants to. It made a difference. It made a massive difference for him. And yeah, in terms of isolation, so if you know, or if anybody listening knows of anyone who is isolated, they don't know where to go, they're struggling with, sometimes, I mean, I will say nowadays, sometimes it's not easy to find friends that you can trust. I'm not saying that we can offer that friendship, but we will definitely support. We have a befriending service, and we will make sure that people do not remain in isolation. And I think, just to chip this in, unfortunately, what people lack is access to information. Sometimes they don't just know where to go. Sometimes, I'm sure, especially with you, Healthwatch in Bury, you're doing an amazing work over there. But sometimes it's just people knowing where to go and how to get there. And it's constantly staying in touch with them and just refreshing that information and making sure that that information gets to them. So yeah, we create that platform. We're in the process of developing more activities in Bury, because we've had community members who've come to us wanting us to do more in Bury. So watch the space. We're planning to have more face-to-face, more presence in Bury, more face-to-face activities, and hopefully work with you, Healthwatch Bury, you know, with, you know, in engaging with the community, the Caribbean and African community.
Well, thank you, Sandy, and it's been a real pleasure for me to listen to that presentation and ask questions today. So thank you for your time.
Thank you very much, Steph.
Sorry, I was muted there. Thank you so much for that, Sandy. Honestly, the amount of information, the amount of work that you do is so impressive. I can't even put words on it. I'm just sat here like, wow. Wow, I can see why you're so proud of everything that you've accomplished here. I really can. So thank you so much for your time today. We really do appreciate it. We'll hopefully be working with you soon.
Yeah, I hope so too. Thank you very much for giving me the opportunity, for giving CAHN the opportunity to talk about what we do. But please do share the information. And I mean, for anyone listening, if you have any question, please do email us either at info@cahn.org.uk or communityengagement@cahn.org.uk. So thank you very much, Charlotte, and hopefully we'll stay in touch.
Absolutely, and all your information is available through us, so should anybody lose them contact information, you can access it by just sending the page a message as well. So I will put it in the comments of the video for you. But thank you so much for your time. It was really nice meeting you.
Thank you, me too.
Bye.
Bye-bye. Bye.